You know, the pressures of everyday life here in Naperville, selling real estate, being a dad to 2 young kids, and trying to keep in some sort of middle-aged shape makes me feel all of the aches and pains. So where do I go when I want to be fixed up? I come to Dr. Jon here at Integrated Physical Medicine. Let's check it out. All right, welcome back to this bonus edition of Naperville Real Talk. I'm here at Integrated Physical Medicine in Naperville with Dr. Jon Polcyn. Dr. Jon, thanks for having us, man.
Yeah, absolutely. Thanks for coming out.
So tell me about the practice. I know you have more than one location. Give me kind of the rundown for people who are curious.
We opened up our first practice in 2009. That was in New Lenox. Since then, we've opened 3 others. This is our most recent open. We opened this facility in 2020 in March. So we opened this.
Good timing.
Right in the middle of COVID. So it was a very boring first year.
Yeah.
But since then has gotten significantly busier. So
okay.
Yeah, we love it here.
So tell me, what does integrated physical medicine mean?
You know, we are by licensed chiropractors, and a lot of chiropractors kind of pigeonhole themselves into doing just chiropractic. So you'll see like Bob's Family Chiropractic or, you know, Wellness Chiropractic or whatever. We didn't want that. You know, it's like naming a grocery store a bakery. You know, yes, we do chiropractic, but we don't just do chiropractic.
Okay.
So integrated physical medicine really encompasses all the rehab, all the manual therapies, all the modalities, all the different things that we do for our patients.
So it's not just the back?
No, we work on everything.
Okay. And tell me a little bit about like your typical patient.
We treat everything from, I just had a week old in here last week, Manny.
Okay, yeah.
Son in, and I have 90 plus that come in. But the real people that we are specifically really, really good at treating is athletes.
Okay.
People in their middle ages, their 20s, their 30s that want to stay crossfitting, they want to stay running, they want to stay cycling, they want to do these things. You know, we're specifically set up for them.
Okay.
And we get great results with them.
So what spurred however many years ago, why did you want to go into this field?
I have like 5 chiropractors in my family.
Okay.
And my partner has a couple as well.
All right.
So we were both looking at healthcare. I was originally going to go to med school to be a surgeon. That was kind of my initial passion. And just kind of did an end around my junior year in college and said, you know what, this is what I grew up with. Let's do what we know. Let's be more on the front end with patients as opposed to on the back end when they're already damaged. And, you know, so that was a great move because it's been very rewarding. You know, for us, you know, teaching people how to maintain themselves is everything.
Are you seeing a trend like in healthcare and medicine of people trying to get on the front end of things more? And
it's been great.
Yeah.
I mean, especially for us.
Yeah.
People know us as that wellness physician. And yes, people are sick of taking all the meds. Parents don't like seeing their kids being put on meds now.
Yeah.
So finding a doc that's very receptive to those thoughts and that wellness mindset is a priority for most people. And we're seeing it younger and younger, which is great. I can do so much more with a 20-year-old that I can do with a 90-year-old.
I can imagine. Yeah, well, I mean, you're right, because I think there's a place for everything, right? Like you talked about originally wanting to be a surgeon. Well, there's a need for surgery.
100%.
But that shouldn't be the first, especially when it comes to like our back and our
100%.
joints. And
so we like to bill ourselves as really that primary care portal to everything else. So if you have an ache or a pain, come see us first. And I have a network of surgeons, I have a network of orthos, I have pain management, I have everybody that you could need.
Yeah.
But most of the time, if it's just a general ache or pain, we can handle it. You don't need to wait in a long line. You don't need to go to the ER for 4 hours. We can get you in, we can assess you, we can image you if need be. And in those cases that are more severe, we'd refer out immediately.
so what do you say? I'm sure you get the people who, you know, somebody recommends them to you and you have a conversation and they say, well, I'm just going to pop a muscle relaxer or whatever. Like, what do you say to that guy?
Those people are out there without a doubt.
Yeah.
And it is easy. Yeah. But what inevitably happens is over time that's less effective and you're really just masking the problem. You know, it's always best to get a clear-cut diagnosis of what your problem is and then you can pick your path forward. If that path forward is purely muscle relaxer or pain meds, so be it.
Yeah.
But at least know what you're doing and know that there are other paths that you can take, whether it's chiropractic care, rehab, manual therapy, massage, all sorts of things. We do dry needling here. So it's not the direction that I would push somebody, at least as a first action.
I think the biggest thing I see, and I don't know if it's America or what it is, but it seems to be in every field, right? I see it in my field in real estate. People hear things from someone and they want to just go right to one like extreme or one end instead of like realizing that it's not a one size fits all.
No.
And it sounds like you're talking about, right,
Yeah.
we're going to do an actual consultation and see what's best for you.
Yeah, and what I'll try to get my patients to understand is you have to know what lens the doctor you're seeing is looking at you through. If your first go-to is an ortho, they're going to either do drugs or surgery. That's what they do. Yeah. With us, our first go-to is how can I help you get better without all that other stuff? What can I teach you? How can I look at your lifestyle? How can I look how you're sleeping, how you're sitting, what your job's doing? Is there repetitive motion? Do you have bad form when you're squatting? Whatever it can be, so we can fix you before you have to take those next step up the medical ladder. Some people end there, but a lot of our patients don't.
Okay. So we're going to walk through today like I'm a brand new patient
Sure.
to the clinic and kind of see how you would approach me just as a everyday 40-year-old dad.
So we really put a lot of effort into our evaluation because it drives all the recommendations, right? Coming to a clear understanding of what the actual problem is has to always, no matter what doctor you're at, has to be step one.
Yeah.
If you ever leave a doctor's office and they evaluate it and you go, I don't know what's wrong, then there's a problem there, okay? So doing a full eval, muscle testing, range of motion testing, orthopedic testing, imaging if we need to, that gets us to a high probability diagnosis. Many cases we end up with like a 95% confidence and then some lower ones that still could be there. That's your differential diagnosis list. That will then lead me to make recommendations as far as services, care that we've done for that particular problem in the past that has been very successful. We'll give a patient options as far as frequency of care. If somebody just doesn't have the time, maybe we have to keep it not all that frequent, but we can give them some more stuff to do at home. But we try to set the bar accordingly. I mean, if someone's coming to me once a month, the odds of me fixing them very quickly is going to be slim.
Yeah.
If somebody really wants changes fast, oftentimes for me to change a body quickly, I've got to see them in pretty rapid succession.
Yeah.
A very common care plan we'll see is a couple times a week or 3 times a week. And we do that only as long as we need to, right? Pain has to come down. We have to be able to educate the patient and give them the tools to take care of themselves at home. When we get to that point, my patients and I kind of keep an open conversation. It's like, okay, I think we're done. You have the things. What we started treating is much better, and you have the tools to take care of it. Right. So that's really beginning, middle, and end for us. Now, if we have a case that doesn't gain as much as we'd like, which happens, sometimes cases or injuries are a little more severe than we hope. Getting somebody to an MRI in a proper amount of time, getting them to see an ortho in a proper amount of time, that happens for sure.
Yeah.
But in the right order.
Absolutely. Well, let's get into what a consultation looks like and
Sure.
go from there.
Sure.
All right, Dr. John, tell me what's wrong with me.
Well, we had some paperwork here that you filled out, a health questionnaire that is a generic form that grabs a lot of information. Yep. Right? That gives me a little bit of your past medical history, what's currently going on. On here, you've got neck pain.
Yep.
Tell me a little bit about it.
A lot of it's probably related to working out. So we got to do kind of like a boot camp morning thing workout. It's kind of like rough and tumble. We're laying down on the concrete, and
Sure.
It's probably not with great form, right?
Now, is it a severe pain? Like, give me a number, 0 to 10.
No. It's more of just like a nagging, kind of tight a lot. Maybe 4.
4 out of 10. Now, is this long-standing? Have you had this for a long time, or is this new?
It comes and goes, but it's not new. I've had this kind of thing for probably a decade or more.
Okay. And was there an incident? Did you have a car accident? Did you fall out of a tree fort? Anything weird?
When I was a kid, one of the kind of big moments was when I was a kid, probably 12, 13. Mm-hmm. Just had a buddy just jump on my back and kind of basically fold me in half,
It's a good buddy.
Yeah. But then after that, a lot of like workout related stuff, messing around with the kids, that kind of thing.
Okay. And are you doing any Olympic lifting? Are you doing anything squatting, deadlifting, heavy weight?
Not really heavy weight, no, mostly lighter weights.
Any CrossFitting, anything like that?
Kind of like that, but again, not heavy weights.
And historically, what have you done for it? Like, what approaches have you used to calm it down when it showed up in the past?
Stretching, have done some chiropractic, like kind of the traction type thing, and comes and goes, but then it's like, it feels like it just pops back up whenever it wants to.
Now, do you have a regimen that you do, that's something custom that's built for you to manage this problem?
Nope.
Okay. Any medications?
Nope.
So no ibuprofen, no over-the-counter, no aspirin, Tylenol, none of that stuff?
Not unless it gets really bad, but not usually.
Okay. Have you experienced any numbing or tingling in your arms or hands?
No.
Weakness into the arms or hands?
Not that I know of.
Do you suffer from headaches?
Only when I don't drink enough water.
Gotcha. And any trauma that you can think of, motor vehicle accident, anything like that? What sports did you play?
Baseball.
Any injuries there?
Legs, hamstrings, knee.
Okay.
Yeah.
And when you have this neck pain, upper back pain.
Yeah.
What makes it worse? Like, what activities do you know will irritate it?
Just like quick movements sometimes, like you turn a certain way and it kind of locks up. I mean, so sometimes being in the car a lot, right? Because it requires a lot of that.
Does it affect your sleep at all?
It can, and sometimes I feel like sleep maybe even exacerbates it if I lay the wrong way.
Well, that leads to my next question. Do you generally have more pain in the morning or in the evening?
Generally morning.
Any imaging studies out there? Have you ever had x-rays, MRIs, CTs of your neck or upper back?
X-rays a while back, yeah, but not recently.
Anything you can think of on there, anything that they found?
Chiropractor said my curve is bad.
Yeah, you'll hear that a lot.
Yeah.
Okay. All right. Well, all good information. Doesn't sound like there's any one significant trauma back in the day. This does sound like repetitive stress. Yeah. At certain ages, we start to feel more pain. It just comes a little easier. I know that I'm there as well at times. So, getting into a setting like this where you have somebody that can help manage this is smart. I think everybody should have their own mechanic, and that's really the role that we try and play.
Yeah.
So what I'd like to do now is I'd like to get into a bit of an eval. Sure. Okay, we're going to go look at your neck. We'll do some range of motion. We'll do some strength testing, make sure there's no neurologic deficits. We will go into some orthopedic tests, and then we'll lay you down and do some palpatory tests, stuff like that.
Cool.
Sound good?
Yep.
All right, I'll have you sit up nice and straight for me. Go ahead and take your chin to your chest as far as you can. Pain, discomfort with that?
Yeah, a little bit on the lower left there.
Okay, extend your head straight back. How we doing? Any problems?
No, that's good.
Okay. I'm going to have you tilt your head. Pain, discomfort?
Just tight.
Other way. Got a little more movement going that way than that way. Can you feel that?
Yeah.
How about rotation? And how are those?
Tighter that way.
Okay.
Yeah.
Let's just check strength. I don't think we're going to find deficits here, but we like to be thorough. I'm going to have you pull your arms right here. Hold that there. I'm going to pull. Don't let me. 1, 2, 3. Good. Hold. 1, 2, 3. Good. Hands down. Right up here. Wrists back. Hold. Hold. Good. Fingers nice and wide. Don't let me squeeze them together. Hold them open. Open. Good. Squeeze them together. Don't let me open them. Nice and strong. Good. Push me away, hard as you can. Push, 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 push. Good. Push, push, push. Good. All felt okay?
Yeah.
Okay. I'm going to come around back here. We're going to do a little bit of palpation on your upper back and neck. Scoot back a little bit for me. Try not to mess up your hair too bad. Tender up underneath the head there at all?
A little on the left side, yeah, but mostly where you just were.
Got some decent sized knots there. A little rough.
Right, yeah.
Okay, gonna do a couple orthopedic tests.
Okay.
This will rule out, disc injuries, stuff like that. Generally, we do these with almost every neck case that comes in. We'll push straight down. Pain or discomfort with that?
No.
Maybe turn your head to the left. Extend towards me, right there. Same test. Anything there?
Mm-mm.
Turn this way. Extend. How's all that?
Good.
No problem?
Nope.
Lifting straight up. This is a decompression test. Let that bobblehead for me. And up. Any problems there?
Nope.
Marvelous. I'm going to have you lay right down. Face goes on the paper and just relax. Are you all comfortable on your belly? Are you okay laying in this position?
All good.
Let me know if anything's tender. We're just palpating the thoracic, upper thoracic, and then into the shoulders. CT junction here. Anything tender?
Just like the upper left shoulder a little bit. That whole side pretty much.
Okay. When was the last time you saw a chiropractor?
A few months.
Yeah? Tender when I go into extension down here at all?
A little bit. Right in there, yeah.
Okay. Ribs feel okay. All right, I'm going to have you flip onto your back for me.
Okay. So I don't want to interrupt your process, but I'm curious, how does massage therapy play into it with you?
So the muscles are connected to the bones,
Yeah.
right? So you're never, ever just treating one or the other.
Yeah.
We like to be as well-rounded as we can be with our care plan. So if somebody comes in and they have issues with their spine, a lot of times the muscles that are connected to it are playing a role.
Yeah.
So the whole integrated physical medicine name encompasses a lot of different things. Okay, I'm going to go through some passive ranges with you. Just relax. Let me move you. Tender it all there.
Yeah, a little.
You've got a little more movement when I do it than when you do it. Good. Last test we're going to do is just going to be a leg hold here, hold that there, as long as you can. This is a disc test. I don't think you have a disc, but we always try and cover our bases. Also, it's going to poke fun at your core. Any pain in the neck, anything shooting down the arms?
No.
Relax. Okay, come on up. So, for me, in an otherwise overly majority healthy individual, we're looking for areas of improvement, right? You didn't come here from a motor vehicle accident, so I'm not looking for broken bones and things that are severely damaged. We're looking for lifestyle. We're looking for lack of understanding of what you can do to keep these areas healthier. We identified in your history that you're not doing really a mobility program that's built for you.
Yeah, right.
That's almost the first thing I'll put in someone's program, because that is a force multiplier. If I can get you doing a lot of mobility work on your own, the stuff we do in office can be focused on other things. So the first few visits with almost anybody, we're training you based on what we see on anywhere from 10 to 20, 25 stretches that you can build into your life. That'll go miles to keep you healthy and feeling good.
Okay.
So building that for you would be a no-brainer. Adjustments for some of the areas that we saw that were very restricted. You had some in your upper back. You had some ribs that were moving a little. I don't want to say that they were subluxated or anything, but just not as mobile as I like to see them on the left side of that upper back.
Okay.
Range of motion, the neck needs a little bit of work. It's not the worst I've ever seen, but there are some imbalances there.
Yeah.
So that's really, in an otherwise healthy individual, what we're looking for on those evals. Areas where we can take you from okay to optimal.
Yeah.
Right? And then train you on the things that you can do in your life to keep it that way. Make sense?
Yeah, totally.
One of the things that we do that's a little different is we're always trying to build that home program as quickly as possible.
Okay.
Right? I don't want somebody in office for 15 weeks.
Yeah.
I mean, it's just, there's no need for that. I should be able to get somebody out of pain. I should be able to train them on the things they need to do, and I should be able to plug that in and hopefully educate them on the importance of that to do at home.
Yeah.
Right? That way we have a happy patient that's feeling good, and they're out in the community telling everyone that when they come to IPM, it's no bullshit. You're going to learn what's wrong with you and learn how to take care of it.
Yeah.
Make sense?
I appreciate it, man. Thanks for having us in today.
Perfect.
So if people want to find out how do they get in touch with you, what do they do?
Website, ipmhealthcare.com.
Okay.
There is frequently asked questions. There is links to how to set up an appointment right there. Phone numbers, emails, all that stuff.
Awesome.
Just hit up the website.
Hey, so I mean, if you guys are feeling any kind of pain, right? Whether you're an athlete, whether you're like me, just a 4-year-old dad trying to get through the day with my kids jumping all over me, whether you've been dealing with an injury for a long time. I mean, Dr. Jon, I think what you've seen is his approach is just straightforward, honest, like he said, no BS, just, hey, let's see what we can do and let's actually customize it for you, right?
Yeah.
And not just a one-size-fits-all, take this pill.
Yeah, and unfortunately, I think a lot of people have had experiences at other chiros that, they're getting a big sale, or you got a big prepay, or you got to come in for 8 months. We are the opposite of that.
Yeah.
I want my patients, how I measure my success is how quickly I can get them functional, how much money we can keep in their pocket, right? Finding the most cost-effective way to get them what they need. And what that does is, my clinics don't grow super fast, but they organically grow over time because people are out in the world saying, he's not going to sell you an 80-week plan. He's going to get you better, get you out, and make you functional.
That's awesome. That's the best news you can have for your business.
Sure.
That's great. Well, thanks again.
Thank you,
Appreciate
Chris.
it.
Appreciate it.
See you guys on the next episode.